Good evening, everyone. I'm Director General Annabelle Pabiona-De Guzman of the Philippine Institute of Traditional and Alternative Healthcare, and I will be sharing about our institute and the work of the Philippines for traditional and alternative healthcare. So, Traditional Medicine Program was launched by then Department of Health in 1992 under the leadership of our then Secretary of Health, Juan Flavier. So the program focused on promoting traditional medicine in the country. So when he became a senator, this was the act that he promoted, the Republic Act number 8423, otherwise known as the Traditional and Alternative Medicine Act, which created the Philippine Institute of Traditional and Alternative Healthcare. So PITAHC is a government-owned and controlled corporation which is attached to the Department of Health. So it is primarily envisioned to help improve the quality and delivery of healthcare services to the Filipino people through the development of traditional and alternative healthcare and its integration into the national healthcare delivery system. What is the vision of PITAHC? It is to promote people's health through traditional and alternative healthcare. Our mission is to lead in the research and development, promotion and advocacy, and development of standards on traditional and complementary medicine. And we ensure that it is accessible, available, sustainable, and integrated into our national healthcare system. So this is the central office of PITAHC. So we have the different divisions. We have support divisions, which is composed of management services, which is also responsible for our planning and also the marketing side of PITAHC. We also have the admin division, and we also have the finance division. We also have 3 developmental divisions, the lead of which is research and development. Then we have social advocacy and standards and accreditation. So this is our 5-story building, which is appropriately colored green. So we are in the East Avenue Medical Center compound in Quezon City. So we have 3 major final outputs to which our budget from the DBM comes from. So foremost of which is research and development. Then we also have our social advocacy division, and we have the regulation of traditional and alternative healthcare, which is our standards and regulation division. So for the major final output, number 1, this is research and development. So for research and development, we provide funding, consultative and technical assistance to institutions and other agencies on matters pertaining to TAC research and development. We have 6 research clusters, one of which is conservation and protection of natural and cultural heritage of Philippine traditional medicine. We also have research and development on the safety, efficacy, benefit, and quality of Philippine medicinal plants and other natural products. We also have clinical research on safety and efficacy of TNCM modalities, information management, policy standards and guidelines, and education and training. Then, for research and development, we also have technology and herbal medicine development. So we develop the following herbal medicines: Sambong tablet as diuretic, Lagundi tablet for bronchial asthma and cough, Peperonia pellucida or Ulasimang bato as anti-gout, and Chuang Gubat as an antispasmodic agent. We also develop, as part of the output of research and development, reference materials for use in developing medicinal plants. So we already have 3 volumes, Encyclopedia of Medicinal Plants Volume 1, Volume 2, and Volume 3. Encyclopedia of Medicinal Plants Volume 1 was awarded the Book of the Year Award in 2017 by the National Academy of Science and Technology, and Volume 2 was awarded also as a runner-up for the Book of the Year Award in 2018. We also will be producing our very first Philippine herbal pharmacopoeia. There was a soft launch last December 22, 2022, but this year we are planning to have it made as a research or a reference material for both Department of Health and the Food and Drug Administration for the licensing of herbal medicines. We also hold an annual research dissemination forum wherein we share to the public the outputs of our researches. Major final output number 2 is for technical advisory and advocacy services. And we organize and develop continuing training programs for medical and allied health workers in the field of traditional and alternative health care. So we conduct basic and advanced acupuncture training for our Department of Health retained hospitals and for our local government units. We also train on acupressure and tuina massage, and we do orientation on the preparation of herbal medicines for our municipalities and barangays in our local government units. Here is an example of our pictures with our trainers doing acupuncture training in the different hospitals of the Department of Health and also the devolved hospitals of our local government units. And these are the community-based training on acupressure, which we conduct with our local government units, mainly among our barangay health workers. These are also examples of our community-based training, preparation of herbal medicine and soap making. So we also conduct this among NGOs, non-government organizations, among civic society, and also to our local government units. Major final output number 2 also promotes traditional and complementary medicine to our conventions, our seminars, and our conferences. Number 1 of which the Hospital Congress, which is held every August of every year because this is Hospital Month. We also have Traditional and Alternative Health Congress in line with Presidential Proclamation number 698, Series of 2004, declaring the month of November as TAC month. And rightly so, we conduct it every November. We also have the Regional Hilot Congress, which is conducted every October in sync with the National Indigenous Peoples Month. So this is our Hospital Congress. So we have already 4 hospital congresses. So the very first one was held in Iloilo. Then the next one was held in Bohol. And after that, we went through the pandemic. So we had only online congress. And this year, or last year, we had the very first hybrid conference, which we developed in Clark, Pampanga. And it was attended by more than 100 doctors and nurses from all over the Department of Health retained hospitals. We also have the Traditional Alternative Healthcare Congress every November. And we have held it first in Davao. And then after that, we held it in Manila at the Manila Diamond Hotel. And after that came the pandemic. So we had to hold it online. And after that, we held it in hybrid, which was last November. And this year, last year, we held it hybrid. There were more than 600 attendees. So this was also attended by the OIC Secretary of Health and other personalities from the Department of Health. So the 600 attendees consisted of 400 online and more than 200 on-site. So this is part of our Hilot Congress. So what is the Hilot Congress? Hilot is the traditional way of doing healthcare in our provinces. So we go to the different provinces and we hold a regional congress. So during the time of the pandemic, we also had our Hilot Congress, and it was attended through Zoom online by our different tribal healers or our helots, as you can see from these pictures. But last year, the other year, I mean 2021, we had the very first regional Hilot Congress in Malay, Aklan. So that's near Boracay. And as you can see, these were the tribal healers who came. So there were more than 100, and they were able to come and attend this Congress, and we were able to address their needs, specifically on the training that they need for the licensing of their craft. So last year, November, was our second regional Congress. It was held in General Santos or in Mindanao. So we had one in Visayas, which is one of the island groups. And then last year we had it in Mindanao. And hopefully this year we will be having it in Luzon. As you can see, most of them are dressed in their traditional garb. And most of them are tribal healers from the different tribes of the Manubo, the Balaan tribes, and other tribes in the hinterlands of Mindanao. So I would like to share some of the videos in connection with this. So the first one would show the prayer before we start our ceremony. So there's an address, and then after the address, they will do a dance which is to call on the highest spirit, the Spirit of God, to bless our convention. Okay, so as you've seen, those were the tribes doing their welcome dance and their opening prayer for our convention. Now, also included in the major final output number 2 of the Technical Advisory and Advocacy Service is the establishment of traditional and alternative healthcare centers, both in government and in our private hospitals. So in line with this, PITAHC has developed the PITAHC Seal of Excellence, which is an award system developed by the Philippine Institute of Traditional and Alternative Healthcare, or PITAHC, to recognize the outstanding practices and contributions of the local government units, the DOH hospitals, the DOH Centers for Health Development, and DOH National Retained Hospitals. So it is envisioned to promote high-quality practice standards to inspire excellence in the community service and to raise the profile of traditional and complementary medicine among Filipinos, health consumers, and the society at large. Okay, so going to major final output number 3, which is the regulation of traditional and alternative medicine practice. This division formulates a code of ethic and standards of the practice of traditional and alternative healthcare modalities for approval and adoption by the appropriate professional and government agencies. So we certify the traditional and alternative healthcare practitioners, and we accredit their facilities and their organizations. So these are the different modalities: acupuncture, chiropractic, homeopathy, homotoxicology, tuina massage, osteopathy, Ayurveda, naturopathy, traditional Chinese medicine, anthroposophic medicine, and Hilot. So the next slide shows the number of our certified practitioners and the number of accredited organization and facilities. Number one is acupuncture, wherein we have 1,158 certified members. Naturopaths, we have over 200. Chiropractic, we have 80 plus. Homotoxicology, homeopathy, we have 39 or almost 40. For our Hilot, we have 24. For our traditional Chinese medicine practitioners, we have 12. Osteopaths, we have 2. And tuina massage, we have 3, or a total of 1,539 certified practitioners. We also have 20 training institutions for acupuncture, homeopathy, and naturopathy. And we have 65 accredited clinics and 9 organizations. So we also have 3 herbal processing plants. So we have one in Tuguegarao, that's for Luzon, one at Tacloban for Visayas, and one in Davao for Mindanao. So these herbal processing plants are essential in the implementation and rollout of the different activities of the 3 major final outputs of PITAHC, because they help in research and development, in the technical advisory and advocacy services, and also in the regulation of traditional and alternative practice. Aside from that, they also produce the following products. Tacloban produces primarily our herbal medicines, namely Lagundi and Sabong tablet, and hopefully in the coming future, our Ulasimang Bato. While Cagayan and also Cagayan Valley, and also Davao produces the 8 varieties of our herbal soaps. Most famous of which is our Bayabas, which is a very good antibacterial and antiseptic soap, and also our Acapulco, which is used as an antifungal agent. So we have the different corporate linkages. We link with local government units, non-government organizations, also with the World Health Organization, with ASEAN, and with other countries. So this is our linkage with Cebu government, wherein we have signed a MOA with them for the establishment of the Cebu Provincial Traditional and Alternative Healthcare Wellness Clinic in their different hospitals within the province. We also have a Philippines-India agreement for the development of Ayurveda and for the promotion of Ayurveda practice in the Philippines. We also have an agreement with Republic of Korea through the National Institute of Korean Medicine, wherein they will be helping us in the technology and development of our herbal medicines. We also have different MOUs with the People's Republic of China, with Nanjing University, with Shenzhen, and also with Fujian University. And just lately, during the first week of January, we inked also another MOU with the Philippine Academy of Family Physicians for the integration of traditional complementary medicine into their residency training programs. What are our 2022 key accomplishments? So we have the Herbal Medicine Access Program, wherein this Herbal Medicine Access Program makes use of the following: So inside the kit that we give away is we have Lagundi, which has been proven by research to have effects on COVID-19, also Sambong, and we also have VCO, virgin coconut oil, which through research with our homeopathic practitioners have also anti-COVID effects. And our antiseptic soap for frequent hand washing is Bayaba soap and Acapulco soap. We have distributed this to local government units, to municipalities, and also to our communities at large. We have also distributed this to our Centers for Health Development. Here we can see the Center for Health Development represented by their Congressman of Tacloban, Congressman Jude Asidri. And then we also have in the Visayas, again, represented by Dr. Adrian Subaan, Director of Region 6, and also in Mindanao, represented by Yusek Dumama. And we have here also the different herbal map packages that we distributed to these areas. So PITAHC, or Philippine Institute of Traditional and Alternative Healthcare, offers options for better healthcare in the Philippines. There is a choice: Western medicine, traditional and complementary medicine, and hopefully in the future, integrative medicine. So thank you very much. May God bless us all.